This presentation is titled Vaginismus, Learning About Our Body by Laura Campbell. The purpose of this presentation this week is to build awareness of the female anatomy and what is causing the pain with vaginismus. One of the methods toward treating this condition is learning about your female anatomy. Warning, there will be diagrams of the vagina for the purposes of education. If you can't handle the pictures, please do not continue this slide or presentation. Again, they are just diagram pictures, but if it bothers you, please stop. This is the external part of the vagina that we're going to start with discussing. The vulva, which consists of the mons pubis, labia minora, labia majora, Bartholin glands, and clitoris. And the vulva's purpose is to allow for sperm to enter, protect the body from infections, and sexual pleasure. The mons pubis is this area above here. It grows hair during puberty. It releases a pheromone which attracts the other partner. This right here is I'll try to draw a little better. There we go. The labia majora, which are the larger lips. They look like lips. And they get hair during puberty. And they protect the other external genitalia. And they secrete a lubricant when aroused. Then, if you look here, these pinkish area that look like lips that are underneath the labia majora is called the labia minora. And the labia minora gets its pink color from blood vessels that, when aroused, fill with blood and swell, and they feel more sensitive. Then right here, in between the labia minora folds, is the clitoris. And when aroused, it actually erects, and this is the organ that's responsible for orgasm. Then if you come down here, in between the labia minora is the entrance to the vagina. This is to allow for the penis to enter, period to come out, or a baby. This right here is this organ right here above the entrance to the vagina is the clitoris, the urethra. And this is where pee or urine comes out. Then if you look down here, right near the entrance to the opening of the vagina, this is where the glands are located. They're called the Bartholin glands. And this is what's responsible for lubricating the entrance of the vagina when aroused. And just a side note for the partners, and even for the woman, is that they often recommend having an orgasm before dilating or having sex. Most women do not have orgasms with intercourse. There's this more the outer, stimulation on the outer side, so that might help. Internal female anatomy. This is the ovary. You have two on each side. Most people do. The eggs are stored in here, and once a month an egg is released into the fallopian tubes. They typically will swap, like 1 month might come from the right, then the next month comes from the left. The egg will travel down the fallopian tubes, and at some point, if a sperm has been released, it will go up into the fallopian tube and meet the egg and become a zygote. The egg or zygote will travel down into the uterus. At this point, the uterus is lined, so if it's a zygote, the zygote will implant into the uterus to create a home. If not, the egg will come down here and it will not implant, and the uterus will start to shed the lining to clean out this area, and that is why you have menses once a month. If the baby does implant, you will not have a period, you will not shed lining, it'll just keep growing. This area here is the cervix. During the pregnancy, there's a mucus plug, and that mucus plug protects the uterus from infections. You'll lose the mucus plug around the third trimester, and this is what they will check to see if it's dilated to allow for the baby to come out. Down here is the vagina, and this is the area the penis enters in and releases the sperm, which will go up into the cervix and then into the uterus and then up to the fallopian tubes. This is also the area where the last part where the baby will enter before exiting the body. It is recommended for women with this condition that you do a little bit of personal self-exploration. A good homework assignment for yourself is to find a mirror and take a look at your own vagina and see if you can find the different parts that we talked about, like the labia majora, the two larger skins that look like lips on the outside, the labia minora, the pinkish area lips on the inside, the clitoris, the urethra, your vagina, by looking and feeling. It is also recommended to touch and find out what feels good and where the pain starts. A good recommendation, because this can sometimes create anxiety, is to take deep breaths, practice some meditation, and exercises to relax before starting the activity. The purpose is to get comfortable and to understand what stimulates your body in a good or bad way, and it can help you to do these with exercises with the dilators. Another reason to touch and feel and find out where the pain starts is that sometimes you can have vaginismus and another condition, and so knowing where the pain starts or where you feel pain can give more information to the doctors. The next part of the conversation is going to be about the pelvic floor muscles, and this really goes into the heart of why we have vaginismus or why vaginismus exists. It's the muscles. The actual entrance to the vagina, which is where the area where the pain is elastic. If you look here on the diagram, there's this red area. There's muscles that surround the entrance of the vagina. And it is these muscles that contract, clamp together, that make insertion impossible, or it's the clamping. It is that action of clamping that creates pain. And it is the brain that sends signal to these muscles that causes them to contract when sexual intercourse or something is trying to be inserted. And it does not happen when things are going out. It's like if you're having a baby, you can have a baby with vaginismus and it will not contract. The issue is when things are being put inside. The brain connection in the pelvic floor muscles. The muscles and areas of the body learn responses from good and bad experiences or the mind's perception. So, like, if you don't understand how your body works, or you've heard stories about how painful it is to break the hymen, sometimes that can create unknown anxieties. The woman does not have control of it. She doesn't know that she's having an anxiety issue about it. But that perception, the lack of education, or the bad experiences, anytime you try to have intercourse or do anything, the brain will send a signal to the muscles and make them contract. This is no way the woman's want or desire or control. They don't have control. And for example, if a person has been raped or had a painful sexual encounter due to a medical condition, the idea that sex will stimulate a negative learned response by the brain. It sends signals to the muscles, they contract to protect the body from further injury, and it is a cause of fear and anxiety. Part of the treatment is retraining the brain and muscles that dilators, a penis, or a speculum can go in without causing pain. And this, for some people, can be very hard. It is often why it is often recommended to pair the dilators up with physical therapy or individual work with a counselor of some sort. It is not a requirement, but sometimes it can help to work on these fears or anxieties and even teach relaxation or breathing methods that will assist on the road to treatment. A personal note, I tried doing dilators. I did find a physical therapist. My physical therapist did not use dilators, but she approaches it with a breathing and learning how to focus on um, understanding your muscles and how to relax them, along with internal work when I'm down in her office and homework that she gives me. And I also use a counselor to deal with my past. I was sexually abused. I'm pretty sure that's why I have vaginismus. Um, and he works on breathing and the anxieties and strategies to cope so that I can focus. I want to thank you for taking time to listen to my presentation. In the future, I plan on going back and giving a more thorough, in-depth discussion of the pelvic floor muscles, like with names and actually going through about what each muscle does. But this gives you an idea as to what causes the pain, being the pelvic floor muscles and the clamping due to fear and anxiety. It also shows you the external genitalia of the vagina and gives you an idea of the internal organs that are responsible for reproduction. Have a nice day, and I'll see you next week.